Here let us discuss about the anastomosis around the scapula. In this module, we will be discussing about anastomosis around the body of the scapula as well as anastomosis around the acromion process of the scapula. So, but in general, the anastomosis of the scapula is maintained by two important arteries as well as their branches. That is, the first part of the subclavian artery by means of thyrocervical trunk, and the third part of the axillary artery by their three branches. So, these are the one actually responsible for anastomosis around the body as well as acromion process of the scapula. So, let us discuss in detail how these anastomotic channels are formed from these particular arteries. So, here as you can see, here is the first part of the subclavian artery. The first part of the subclavian artery gives off totally four branches. One is ascending cervical, inferior thyroid, transverse cervical and suprascapular artery. The transverse cervical artery in turn immediately gives off two important branches. One is the superficial branch, another one is the deep branch. So, from the thyrocervical trunk, the suprascapular artery as well as the deep branch of the transverse cervical artery are the one which take part in the anastomosis around the body of the scapula. In the same way, the circumflex scapular artery, what you are seeing at the lateral border of the scapula, the circumflex scapular artery which is the branch of subscapular artery, and this particular subscapular artery which arises from the third part of the axillary artery take part in the anastomosis around the body of the scapula. So, what are the three principal arteries which are taking part in the anastomosis around the body of the scapula? One is the deep branch of the transverse cervical artery. Second one is the suprascapular artery. Both are the branches from the thyrocervical trunk. And next one is the circumflex scapular artery, which is the branch of subscapular artery which is arising from the third part of the axillary artery. This is what is about anastomosis around the body of the scapula. And when we see the anastomosis around the acromion process of the scapula, acromial anastomosis is maintained by three important arteries. So, here not only the third part of the axillary artery, second part of the axillary artery is also taking part in the anastomosis around the acromion process. So, if we talk about these arteries, the acromial branch of the thoracoacromial artery, we know that the thoracoacromial artery is a branch of second part of the axillary artery. This thoracoacromial artery totally gives off four branches. One is the acromion branch, one is the deltoid branch, clavicular branch as well as pectoral branch. So, out of all these four branches, acromial branch of the thoracoacromial artery, which is a branch of the second part of the axillary artery, take part in the anastomosis around the acromial process. And in the same way, the acromial branch of the suprascapular artery as well as the acromion branch of the posterior circumflex humeral artery. So, these three arteries take part in the anastomosis around the acromion process of the scapula. And this is what is about anastomosis around body as well as acromion process of the scapula. Now, why this anastomosis is extremely important for us to know, and there must be some clinical correlation with this scapular anastomosis over here. So, in the event of a subclavian and axillary artery blockade anywhere between the first part of the subclavian artery or the third part of the axillary artery, this scapular anastomosis is the one which serves as a potential pathway like a collateral circulation between the first part of the subclavian artery as well as the third part of the axillary artery, especially to ensure an adequate circulation mainly to the upper limb. That is the reason the scapular anastomosis is extremely important clinically, and this is what is about anastomosis around the scapula.